Welcome to the We Level Up Treatment Center video series. In today's video we will discuss how long does cocaine stay in your system, urine, hair and blood. Are you wondering how long cocaine can actually be tested for? Let's begin exploring the facts about cocaine testing and more about this topic. When someone must submit to a drug test, they may be concerned about how long cocaine stays in urine or their system. While the duration of cocaine in urine can vary, a good range is often up to 4 days. Cocaine is a central nervous system stimulant primarily abused for its euphoric effects in recreational settings. Also called coke, the drug is used to get high by millions of people and is tested in most drug test panels. Let's get to it. So, how long does cocaine stay in your system and how long does cocaine stay in urine? The ability of cocaine to be detected in urine, blood, and saliva drug tests will vary depending on a number of variables. Cocaine and its metabolites typically remain detectable in the body for 3 to 4 days after the last use, and up to 2 days after that in blood or saliva. However, the testing window for the cocaine metabolites that urine cocaine drug tests can detect is up to 4 days. The half-life of cocaine is the amount of time it takes for the body to eliminate half of a dose. Cocaine has a half-life of 6 hours in the urine or blood and 1 to 1.5 months in hair, on average. The half-life of cocaine is shortened when it is smoked, slightly prolonged when it is injected, and longest when it is snorted. The metabolites of cocaine, however, have a longer half-life. The metabolite is a by-product of cocaine and their half-life can double to 12 hours when testing for cocaine alone. So, how long does cocaine stay in urine? Cocaine's metabolites or byproducts are what determine how quickly it can be detected in typical urine tests. The most accurate estimation of recent cocaine use is provided by detecting these byproducts. When cocaine is ingested, the body naturally produces metabolites as a breakdown product. Because they linger in the user's system longer than cocaine does, these metabolites are detected in drug tests to demonstrate recent cocaine usage, particularly in urine. The half-life of the most prevalent metabolites in urine is around 12 hours. As a result, although cocaine may normally be found in urine for 3 to 4 days, it can also be discovered in some urine samples for up to 2 weeks and for up to 6 months in hair samples. The typical how long cocaine stays in urine detection window is 4 days following consumption. However, the drug may continue to be detected in heavy users for up to 10 days to 2 weeks after consumption. It's crucial to remember that a number of factors might affect how long cocaine is detectable in urine. These consist of the person's weight, age, general health, and the presence of additional drugs or prescriptions in their system. The detection time can also be impacted by the sensitivity of the urine test and the laboratory's cutoff level. It's also important to keep in mind that other techniques, including testing for cocaine in saliva or hair, may be able to identify the drug for a longer length of time. A hair test for cocaine is reliable for months to even years. While prolonged excessive cocaine usage can show up as positive in a urine test for up to 2 weeks, other factors can affect urine and other cocaine test results. It should also be noted that the body's ability to rid itself of cocaine may be delayed if alcohol is consumed while using cocaine. Typically, a saliva test can identify cocaine for up to 2 days. The most typical way to collect cocaine salvia licks is to swab the inside of the cheek or beneath the tongue with a swab stick that has a sponge or absorbent pad attached. To obtain saliva for evaluating the presence of cocaine in your system, further techniques include spitting, draining, and suction. Cocaine is processed by blood and liver enzymes. Its main urinary metabolite is benzoylecgonine, which is followed by ecgonine methylester. Benzoylecgonine can be detected in a person's urine for up to 4 days, depending on how frequently they use it, their metabolism, and the amount. Due to its 100 times higher concentration in urine than cocaine, benzoylecgonine is the main cocaine metabolite used in drug testing. Alcohol consumption before, during, and after cocaine use is another element that is crucial to cocaine drug testing. Contrary to most other drugs, alcohol and cocaine interact to form a new molecule called cocaethylene. Compared to benzoylecgonine, this chemical has a longer half-life and will remain detectable in the body for longer. The majority of the time, It takes up to 7 days for cocaethylene to be completely eliminated from a person's body. providing they don't use any more cocaine or alcohol or dehydrate themselves during this time. About cocaine. Cocaine, sometimes known as coke, is a potent but short-lived central nervous system stimulant that produces an ecstatic high. The effects of cocaine can last anywhere from a few minutes to an hour, depending on how it is used. Different people are affected differently by cocaine's high. However, a high typically begins nearly immediately and lasts for a few hours. Even while it seems straightforward, the body is actually quite active. Cocaine affects the brain immediately after ingestion, whether it is by snorting, smoking, or intravenously. The extreme sense of euphoria we refer to as getting high is brought on by an excessive buildup of dopamine. Additionally, it acts as a stimulant, encouraging exuberant energy and stimulating conversation. Cocaine can have an adverse effect on a person's entire body in addition to their brain. How long does cocaine stay in the body? The health of the user, the quantity of substance used, and its purity are only a few of the variables that affect how long cocaine's effects lasts. The drug's increased dopamine levels eventually force the reward circuit to adjust, gradually losing sensitivity to them. In order to maintain the same high from the beginning and to get relief from the negative effects and withdrawal associated with cocaine use, people must take stronger and more frequent dosages of the drug. Cocaine's effects begin to manifest faster and last longer overall depending on how you consume it. Cocaine's typical consumption use includes snorting cocaine. In 3 to 5 minutes, the effects begin to kick in and might continue up to 20 minutes. Smoking cocaine. Within 5 to 10 seconds, effects begin to kick in and can last up to 20 minutes. Shooting up. Intravenous use. Effects can be felt for up to 20 minutes and are apparent within 5 to 10 seconds. Oral consumption. The effects begin in 10 to 30 minutes and might last up to 90 minutes. Cocaine's growing drug of choice prevalence. The prevalence of drug use in the American workforce has increased to its highest level in 12 years, driven by illegal substances like cocaine. The world's largest provider of diagnostic lab testing services, Quest Diagnostics, conducted a review of more than 10 million workers' drug test results. More American workers than ever before have tested positive for cocaine usage. According to a 2017 news release from Quest Diagnostics, one of the nation's blood and urine drug testing labs, positive cocaine test results increased to a 7-year high in 2016. Notably, the positive rate for cocaine tests performed after employees were involved in accidents was double the rate for drug testing completed prior to employment. Cocaine is the second most trafficked illegal substance in the world. The most recent statistics show that 756 metric tons of cocaine have been seized abroad, with North America and South America stopping the bulk of the drug trade. Injecting or inhaling cocaine can produce both a rush and a high. Binging is the practice of frequently consuming cocaine over a short period of time to maintain a high. When cocaine is used repeatedly, it's easy to develop a larger tolerance and even addiction. According to the National Survey on Drug Use and Health, 966,000 Americans aged 12 and older were estimated to have cocaine use disorder, often known as cocaine addiction, in 2017. The way cocaine is consumed, by injection, smoking, snorting, or oral ingestion, can affect the length and potency of its high. So, how long does cocaine last in the body? For instance, snorting cocaine might cause the high to start rather slowly and linger for 15 to 30 minutes. How long does the high from cocaine last? Smoking this substance causes faster immediate effects that last 5 to 10 minutes. But this high is usually followed right away by a collapse that can leave one feeling anxious, tense, agitated, depressed, and exhausted. Cocaine's stimulant ultra-fast cycle is what makes it so addictive. That's it for today. If you like our video, please let us know. Have a great day.